We are doing oral histories for Celebrating Nursing in the Upper Cumberland, the upcoming exhibit that will open on March 30th, 2019. Hello, how are you?
Hi, I'm good.
Good. Just for the record, your name and hometown.
I am Sandy Dunavan-Johnson, and I am originally from Trenton, Tennessee.
Okay, excellent. How long have you been in the nursing profession?
My 25th year will begin in May of this year.
I don't believe it.
I know, it's amazing.
Okay, tell me a little bit about your education as far as your nursing career.
I started at Tennessee Tech and did all of my what they call underdivision classwork, which is your biology and chemistry and all of the sciences. And then I ended up moving to South Carolina, so I did all of my upper division nursing classes at Clemson University and graduated from Clemson in 1994.
Okay, and then where did you go from there?
I actually worked in labor and delivery in South Carolina for all of 3 months.
Oh.
Before I ended up relocating back to Cookeville, and then I've been back in Cookeville since then.
Okay, well, tell me a little bit about your career trajectory. How did it progress?
Oh, and that's the great thing about nursing is you can do so many different things in nursing. So I started off as a med-surg nurse, which is someone who works on the floor after patients have surgery. And that was an orthopedic surgery. It could be an obstetrical, gynecological surgery, lots of gallbladder surgeries and that kind of thing. So I did 1 year of that at Cookeville Regional Medical Center. And then I went to the ICU there. So I did ICU nursing for about a total of 7 years. And then I moved into what was almost kind of a newer thing at Cookeville called case management. And this was a nurse who followed patients from the time they were admitted to the hospital all the way through their discharge. And we made sure that the insurance company was given all the information that they needed for the patient. And then we made sure that the patient had what they needed when they were discharged home. Could it be home health or oxygen or some kind of physical therapy or equipment, that kind of thing.
So it was really advocating for those patients.
Yes, and that is something that nurses do every day is they advocate for the health of the patient. Yeah. And a big part of that is just looking at the patient as a whole person, not just what's wrong with them at that moment. So that's why case management was a great fit for me, was because I like to see the whole picture and make sure that the total package is taken care of when a patient goes home from the hospital.
Sandy, what are the best and worst parts of nursing, in your opinion?
Well, definitely the best part of nursing is being able to be there for patients. And also for the families. The families are very concerned, and a lot of times they don't understand what's happening. So a big part of nursing is helping to communicate and translate what's being said and what's being done.
That's important.
That is very important.
Putting it into those layman's terms for people.
Yes.
Yeah, everyone has been there.
And that's a big part of why I went into it, is to help do that. The worst part, unfortunately, is that 12-hour shifts are the norm for floor nurses. And that's hard, and it is long. And a lot of times you need to do more than is physically possible in that 12 hours. So it can be just very, very just stressful and just difficult.
Just for people who don't know, the 12 hours, is that because the transition is so difficult if you're taking care of someone that, why is the 12-hour shift the norm?
I honestly don't know.
Okay. But it is.
Really
it's pretty
don't.
standard.
Oh, it is. It is 7 to 7 shifts.
Yeah.
Mm-hmm.
Yeah. Okay, well, tell me a little bit about what your career is now.
Well, so I did the case management with Cookeville Regional for about 15 years total. And again, a lot of that was communicating with insurance companies about hospital stays. A lot of people don't realize that your insurance company wants to know what's happening when you're in the hospital. And there are people in the background doing all of that communicating. And it is while it's happening. It's not on the back end after you're discharged. Insurance companies are notified the day after someone's admitted usually.
Wow.
And so after doing that for quite some time, I have now moved into working for an insurance company and doing just the other side of what I was doing at Cookeville Regional, which I think my background from the hospital helped a lot, helping me understand what the hospital has to deal with to get the information and get the right information to the insurance company.
Yeah.
So
well, and you've looked at clouds from both sides now.
Yes,
so.
exactly. Yes.
What are the biggest changes you've seen since you started nursing?
Well, the first thing that comes to mind is technology, definitely. And with the computerization of all of the medical record, when I first started as a nurse, we would look on the computer for lab work and x-ray results and that kind of thing, but we hand wrote everything. Everything that we did all day was handwritten onto a piece of paper. And then that was compiled into the medical record. And gradually, now everything is computerized, and nurses have either a handheld device that they take with them to chart on, or they have a rolling computer, and everything now is typed into a computer.
So that's got to make things...
It is.
Well,
it's
easier,
huge.
and easier, and not everyone writes the same way, and
Well, and that is part of the nursing education, though. We are really drilled into how to document things.
Yeah.
And the funny thing that I've told people is, nurses don't speak in full sentences, and we don't even use complete words. There are so many abbreviations, and you chop off things, and so a lot of times just composing a letter is difficult for me because I'm used to just charting and talking in little sentences. But because of this technological advance with computers, now my job with the insurance company is completely done in my home. So I work from home on a computer all day. I can access some of the hospitals that I deal with. I access their medical records on the spot by computer.
Wow.
So in real time, I can see what's happening with the patients that are covered by our company.
It's just a whole new world,
It
isn't
is. Yes, it is. And it's been it's been a big change. I know long ago they would fax just pages and pages and pages of paper to insurance companies, and it would take months and months and months to get things processed through the system.
Yeah. Well, and that's one good thing, especially for patients who are waiting for the outcome.
Yes, absolutely.
Yeah, have those results faster. So.
Oh yeah, and hospitals too.
Absolutely.
Yes, they can get their reimbursement a lot faster.
Yeah.
With this. So.
Do you have anything else that you'd like to add today, Sadie?
Just that nursing is just a wonderful thing. It's not just a profession. It usually ends up being just part of who you are, and it is just who I am. I am a nurse. I don't know, it just kind of overtakes your personality, I guess.
Well, I, for one, am glad you are, and I know that there are lots of other people who feel the same way. So thank you so much for coming in to talk to me today.
Thank you.